Welcome to the introduction to the study of exercise science. The first step in understanding this field is to create a common language that will be used for communication. This information is essential for anyone studying the field of exercise science, anatomy, biomechanics, and all healthcare fields. This session will focus on understanding anatomical terminology. The Commission on Accreditation for the Exercise Sciences has established content knowledge, skills, and standards for what all exercise scientists should know. Their first standard that we're going to cover in our series is Standard 1E subset 1E, which basically says exercise scientists should have the knowledge of muscle action terms, including anterior, posterior, inferior, superior, and so on. And that's what we're going to cover in today's session. So let's start off with some fundamental anatomical terminology. And before we get started, I just want to mention that terminology is used in every single field. Most people have played sports before, and let's take the sports of baseball and softball. Coaches need to be able to say to their athletes, choke up on the bat, move to the front of the box, turn two, lay down a bunt. That's common terminology that's used in baseball and softball. If the athlete or the coach doesn't understand that terminology, it interferes with the ability to communicate in the field that they're in. And it's the same thing in exercise science. We need to be able to use terms like superior or proximal or superficial or contralateral when we're describing joint motions and places of the body. So let's go through some of the fundamental terms that are used in anatomy, in physiology, and of course in exercise science. And it all starts with the anatomical position. If you look at the picture to the right, you can see the person or this skeleton is in the anatomical position. In this position, the person is standing upright, feet are facing forward, and this is an important concept. The palms are also facing forward. So that means that the radial ulnar joint, which we'll talk about in a moment, is in a supinated position and head is forward. Whenever we describe any type of motion, we're always going to imagine the person in the anatomical position. It is the reference position. Now, the next term we want to use is a term called the midline of the body. The midline of the body is a vertical line that runs straight down the middle of the body that literally would separate the person into right and left halves. So things that are closer to the midline of the body, we use the term medial, and things that are further away from the midline of the body, we use the term lateral. So let's go through some of the terms and imagine again, when we use these terms, we're talking about being in the anatomical position. It's also really important to understand that these are not terms that can be used by themselves. They're all relative. So when we use the word anterior, we have to be comparing that body part with another part. We can't just say the elbow joint is anterior. We have to be describing it relative to something else. So the words anterior versus posterior. Anterior means towards the front of the body, the face side or the chest side of the body, and posterior means towards the back side of the body. So we could say that the sternum, which is located right here, is anterior to the vertebrae, which would be located more on the posterior side. The next two terms are superior and inferior. Superior simply means above, and inferior means below. But when we use superior and inferior, we always need to recognize we're talking about the person being in an anatomical position. If we flip them upside down, superior and inferior don't change because we always imagine the person in the anatomical position. So we can certainly say that the head is superior to the feet. We could say that the hand is inferior to the shoulder. As I said before, medial and lateral refers to the closeness or proximity to the midline of the body. So we could say that the ulna bone right here is medial relative to the radial bone because it's closer to the midline of the body. And again, we have to be talking about it in the anatomical position. We could say that the spine is medial relative to the humerus because it is right along the midline of the body. Distal and proximal are two terms that very often become confusing, so let's just spend a moment on that. When we use the terms distal and proximal, we are talking specifically about the arms and the legs. We do not use these terms when we're talking about the axial skeleton or the skeleton that runs down the midline of the body. We're only using them when we're referring to the appendices of the body. So obviously your arm attaches to the trunk of the body at the shoulder joint, and the leg attaches to the pelvis at the hip joint. So the word proximal refers to any part of the body that is closer to the point of attachment. So we could say that the patella is proximal relative to the ankle, because if we follow up the leg, the patella is closer to the hip joint than the ankle is. We could say that the elbow joint is proximal relative to the wrist joint, because the elbow is closer to the point of attachment, which is the shoulder joint. And then, of course, we could use the term distal to refer to, say, the phalanges, which are the finger bones, relative to the carpal bones, which are the bones of the wrist. Prone and supine refers to the way that the person is positioned. So when you're lying on your stomach, you're in a prone position. When you're lying on your back, you're in a supine position. Now, obviously, those terms don't really refer to being in the anatomical position necessarily. It refers to the way that you're lying down. The next two terms, superficial and deep. So something that is superficial is closer to the surface of the body, closer to the skin, and something that is deep is exactly what it says, deep inside the body. So we could say that the sternum is superficial relative to the heart, because the heart would be deeper inside of the body, whereas the sternum would be superficial. We could say that the skin is superficial relative to the muscles, because the muscles are underneath or deeper. And then the last two terms may also be confusing for some people, contralateral versus ipsilateral. When we say contralateral, we're talking about the opposite side of the body. So we could say the contralateral arm from the left leg would be the right arm, the opposite side. And then ipsilateral means the same side. So the ipsilateral side of the left leg is the left arm. Just to give you an example of that, when you throw a baseball or a softball or anything for that matter, you are always going to step with the contralateral leg to your throwing arm. So if you're right-handed, you're going to step with your left foot and then release the ball. If you're left-handed, you're going to step with your right foot and then release the ball with your left hand. So contralateral, the opposite side of the body; ipsilateral, the same side. It's very important that you don't move forward in learning any other terms until these terms become very simple to you. One of the best ways to do that is to literally write out a sentence of the location of different parts of the body and use these terms to describe how they're located. So now we have to apply what we've learned, and it's very important before you move into the next series of information to make sure that you have this down and this information becomes a part of your common language. When answering these questions, it is essential to not look at your notes or any other materials that might cue you to the answer. If you use notes, it'll give you the impression that you know it when you really don't. So answer these questions by writing down your answers on a sheet of paper. Keep that paper with your notes and have access to them in class or where you work until they become a part of your common language. Physically writing down sentences, I know that's a little bit of a pain, will help you to not only know how to spell them, but also to remember that information. So please take time to go through this information and create those sentences.